Hey everybody, it's Chad Campbell, Certified Functional Medicine Provider with Redesign U and Hope Family Care Center. And I've been getting actually a lot of questions about the hydroxychloroquine and Zithromax that people have been hearing about. So I wanted to do a little quick update on where they're getting all this information from. So first off, I want to thank everybody for the masks and the prayers. And we've had people make us door stoppers and donated some respirators for us, and we appreciate you helping us to be able to get through this to help everybody else. All right, so let's do that. So what happened was this study started early March to about March 16th in France. What they were doing was giving people hydroxychloroquine daily, and then they wanted to retest the viral load after that. This was done in a hospital setting, not done in an outpatient area at all. So they offered this to people, and for those who didn't want to do the treatment, they put them as the protocol, as the control group, meaning no treatment, no medications for them. Now, these were all people that tested positive for COVID-19. Okay, so the study went from the beginning of the treatments, and then they retested 6 days later. All right, so that's the end point for what they were testing for. Out of the people who were put into this little study that they did, 6 of the patients had no symptoms at all. Now, these are people in the hospital, okay? 6 patients had no symptoms. 22 patients had upper respiratory symptoms here, and 8 patients had lower respiratory symptoms. All right. They did include people who were already hospitalized for this, and it didn't matter what their clinical status was, meaning it didn't matter when they had tested positive. If they had tested positive 3 days ago or now, they were in the hospital, they went ahead and put them in this test, in this study. The people who were excluded were people who were allergic, who had known allergies to this medicine, who had retinal problems already, who had heart arrhythmias already, who had what's called a G6PD deficiency, which is a carbohydrate metabolism problem, genetic thing. They weren't allowed in it. And if you were breastfeeding or if you were pregnant, then you weren't allowed in this either. So during this, the hydroxychloroquine was the base. Then the investigators were allowed to give antibiotics or other supportive treatments if they felt the need to. And we don't know what those other supportive treatments were. We don't know what those other antibiotics were. We know that Zithromax was one that was used, but we don't know, was it used along with something else? Okay, so they lost 6 people to follow up in the study. And out of those 6 that they were lost, 3 were transferred to the ICU. One of them was transferred on day 2, one was transferred on day 3, one was transferred on day 4. One patient died. One patient decided to leave the hospital on day 3 and didn't want to be part of it. And then one patient stopped the treatment because of the side effects. So now we go to this. We have 36 patients who are in this study. All right, 20 are hydroxychloroquine treated patients. 16 are the control group that aren't getting anything at all. Okay, none of the 16 of the control group were lost. None of them fell out. So just to go over the symptoms before. The symptoms before the treatment, 16.7% of the people in this were asymptomatic. Okay, 61.1% had upper respiratory symptoms, nose, sinus, throat symptoms. 22.2% had respiratory symptoms, coughing, pneumonia, those things. All right, so among that hydroxychloroquine treated group, that 20, 6 of those received Zithromax or azithromycin, Z-Pak, to prevent bacterial superinfections. They had to be monitored 24 hours a day on EKG because of the possible side effects. So on day 6, when they went and retested these people, 100% of the patients treated with hydroxychloroquine and azithromycin, Z-Pack, 100% of those by viral studies were completely cured. 57% of patients treated with just hydroxychloroquine only were cured, and only 12.5% of the control group who didn't receive anything were cured. The confusion with this is that you could have been anywhere in that, how long you'd had it already. You could be anywhere in there. It doesn't have the difference of who is upper respiratory here versus lower respiratory differentiated, and we don't know the sickness of each of those. So they did show that patients who were still positive on the viral test, who were on just hydroxychloroquine, they gave them the azithromycin, and on day 2 after doing that, the infection was gone. In contrast, they showed that patients who were on the hydroxychloroquine and azithromycin combination who tested negative on the end of the study, one of them still came back and tested positive 2 days later. So they were negative and then they tested positive again. So you can see this is such a inconsistency, okay? I mean, there's some good hope, but it's inconsistency. In this, 2 of the failures of the hydroxy group was a mom and son. So they think maybe there was some type of genetic morphism that created them not to be able to respond to those medications. So this is my takeaway from this thing, is that the study is good. Somebody did this. They just brought their information together. It's not peer-to-peer. It's nothing like that. It's just, here's what we tried. Here's what we recognized. It was all over the place, from people being completely asymptomatic to people being in the ICU. So we don't know the difference of who it worked on, who it didn't work on. Everybody had to be monitored the entire time because hydroxychloroquine and azithromycin both can cause heart arrhythmias. So you have to be monitored on EKG 24 hours a day, especially if you're taking both of these. So I'm not against the study. I'm not against this thing that somebody brought together as a possibility. Maybe it gives us some hope into some treatments. What I am against is using this as a protocol when it was done in such a small group, the inconsistency in the people and who it actually worked on and who it doesn't work on, the inconsistency in the reporting and the findings, because we don't know, it's all the way from asymptomatic to ICU patients. So we don't know, was it used in the less symptomatic group? Was it used in the more symptomatic group? We have no idea with that. And you have to be monitored 24 hours a day on EKG because of the possible side effects of hydroxychloroquine as well as azithromycin. So that's my takeaway with this. I hope this helps everybody. I'm not saying that I know the answers. I'm saying that when something comes out like this, I want to give you the true understanding and the true facts so that you can take the facts over the fear and make a decision on what you think is best. Until next time, stay safe.